again, thank you, Madam Grosset. This really is a real and growing threat to European citizens, not just via the internet, though again I would echo Madam Grosset's recommendation. You should not be buying drugs over the internet. The risks are just too high. But these counterfeit drugs are also infiltrating the legitimate supply system. And the reason for that is obvious. Organized crime is finding it more profitable to be involved in the field of counterfeit medicine than illegitimate drugs. And the risks are much lower. So we should not be surprised about the consequences and risks we're facing. As an industry, we are very concerned that European citizens know that the medicine dispensed by their pharmacist is precisely what the physician has prescribed and we, the manufacturer, have produced. We have recently launched a project in Sweden which is piloting a new coding and verification system for prescription medicines. The pilot is in cooperation with the Swedish pharmaceutical retailers Apotek, AB, and local wholesalers. It's designed to be inclusive, proportionate, and cost-effective for all elements of the supply chain. We believe, and indeed are confident, this system can be the basis of a cost-effective and harmonized system that could be implemented across member states. It involves mass serialization and individual tagging of each pack. However, let me make it clear, although this type of end-to-end verification system will make a significant contribution, as you've also heard from Madam Grosset, it alone cannot banish the threat of counterfeit medicines. This solution must be supported with appropriate legislative measures to ensure that the punishment for counterfeit medicine is in line with the significant health risk it represents. It also requires, from our perspective, an understanding of the need for original pack integrity. When products are repackaged other than by the manufacturer, the effectiveness of any counterfeiting measure on the packaging is compromised. So we believe that whilst a few of the recommendations in the pharmaceutical package are a step in the right direction, we were disappointed that there was not a ban on repackaging. I believe the EFPIA pilot in Sweden, as I mentioned, can provide us with a roadmap forward. But again, I would like to make the point this morning that patient safety can only be effectively delivered through the government's commitment to effective regulation and strict law enforcement. I look forward to seeing, Madam Grosset, the outcome of the pharmaceutical package, and again I encourage you to remain a vocal champion of what I still believe is an underestimated risk to the health of European citizens. With that, I believe Madam Grosset and I will be happy to discuss not only counterfeit medicines, but our respective views on the shape and future of the pharmaceutical industry and health systems in Europe. We now be very welcome to receive your questions.